You take heart medication every day to keep your heart alive. But what if I told you that the same pills that protect your heart could also be causing your blood to not flow as well down there? I've met countless men over 60 who feel depressed, tired, and afraid to ask their doctors if their medications are silently draining their vitality. In this video, I'll reveal the 3 most common medications that are silently impairing blood flow. And more importantly, what you can do without ever putting your heart at risk. Stick with me, because what I'm about to share may explain more than you think. When I first met Robert, a 66-year-old retired engineer, he had been on a beta blocker for almost 5 years. His cardiologist prescribed it after a mild heart attack, and the medication did its job. His heart rate stayed steady, his blood pressure stayed under control. On paper, everything looked good, but Robert's voice was heavy when he told me, "Doctor, I feel like a different man. I don't have the energy I used to, and my mornings are flat. I thought surviving a heart attack would give me gratitude, but instead I feel like I've lost a part of myself." This is not rare. Beta blockers, drugs like metoprolol, atenolol, and propranolol, are life-saving for the heart. They work by slowing the heart rate and reducing the force of contraction, easing the strain on damaged arteries. But here's what most men don't realize. By doing their job so well, they can also reduce blood flow to the body's smaller vessels, including the ones that matter most for a man's confidence. Several studies have confirmed this effect. Research published in the Journal of Clinical Hypertension has shown that long-term use of beta blockers is linked with reduced exercise tolerance, fatigue, and even erectile difficulties. The reason is simple. With a slower heart rate and decreased cardiac output, the blood doesn't always reach peripheral tissues as strongly as before. And when blood flow weakens down there, the signals that once came naturally in the morning can fade away. Robert's story echoes that of many others. These men take their pills faithfully, grateful to be alive, yet quietly grieving the loss of something deeply personal. They rarely tell their doctors, out of embarrassment or fear of being dismissed. Instead, they silently endure, believing this is just the price of survival. But here's what I told Robert. You don't have to choose between your heart and your vitality. The key is not stopping the medication, that would be dangerous, but understanding what's happening and making targeted changes to support circulation in other ways. And here's the mini hook. What shocked Robert even more was learning that another class of common blood pressure medication, one he thought was completely harmless, could sap his blood flow in a very different way. Robert wasn't the only one. A few weeks later, another patient, James, 68, a retired bus driver, came into my office with almost the same story but a different prescription. His cardiologist had placed him on a thiazide diuretic, a tiny pill that worked by helping his body flush out excess salt and water. It kept his blood pressure in a safe range, and his doctor was pleased with the numbers. But James was not. He leaned forward, lowered his voice, and said, "Doctor, I feel dried out. My energy is gone. And honestly, I don't feel like a man anymore." His words carried both shame and frustration. Thiazide diuretics, drugs like hydrochlorothiazide and chlorthalidone, are some of the most commonly prescribed blood pressure medications for men over 60. They're inexpensive, effective, and often used as the first line of defense. But here's the part few men are warned about. By flushing fluid and altering electrolyte balance, they can also interfere with circulation, testosterone production, and even nerve signals involved in arousal. Studies in the American Journal of Hypertension have noted a higher rate of erectile difficulties in men taking thiazides compared to those on other blood pressure medications. The mechanism isn't only about blood volume, it's also hormonal. Thiazides can lower zinc levels, which are critical for testosterone synthesis. Over time, this subtle hormonal shift can quietly drain vitality, leaving men like James wondering what went wrong. When I explained this to him, James let out a deep sigh. "So it's not just me getting old?" he asked. That moment was powerful. He realized he wasn't broken, and he wasn't alone. Of course, I reminded him, stopping the medication without medical guidance would be dangerous. His heart needed the protection. But there are ways to counterbalance the side effects. Diet rich in leafy greens and nuts, regular movement, and open conversations with a trusted physician about alternatives. And here's the mini hook. The surprise for James came when I told him that even medications designed to protect the arteries themselves, statins, can sometimes have hidden effects on energy and blood flow. James's relief was clear, but I could see the worry still in his eyes. So I leaned in and said, "There's another class of medication you should know about, one that millions of men over 60 take every single day, statins." That was when Daniel, a 70-year-old retired accountant, shared his story. "Doctor, I've been on cholesterol pills for nearly a decade. My cardiologist says my arteries look great, but I'm constantly exhausted. And lately, intimacy with my wife feels almost impossible. Could it be the statin?" Statins, drugs like atorvastatin, simvastatin, and rosuvastatin, are among the most prescribed medications in the world. They lower cholesterol, protect the arteries, and significantly reduce the risk of heart attacks and strokes. On the surface, they're miracle drugs, but here's the hidden side few men are warned about. In some patients, statins may interfere with hormone production, muscle energy, and blood flow. Cholesterol isn't just a villain. It's also the building block for testosterone. When cholesterol levels drop too low, testosterone production can dip. The result? Fatigue, muscle weakness, and yes, circulation problems down there. A study published in the Journal of Sexual Medicine highlighted that men on long-term statin therapy reported higher rates of erectile difficulties compared to men not on the drugs. While not everyone experiences this, the connection is too important to ignore. Daniel described his days as blurry. He had the numbers his doctor wanted, but he felt less alive, less himself. "I thought I was doing everything right," he confessed. I reassured him. Statins are vital for protecting his heart. The solution is not to quit, but to understand and adapt. Through lifestyle changes, like regular physical activity, foods rich in antioxidants, and careful monitoring of hormone levels, many men can offset the side effects. Sometimes, switching to a different type of statin under a doctor's supervision can also help. Most importantly, Daniel realized his struggles weren't a personal failure. They were a known side effect, one that could be managed with the right strategy. And here's the mini hook. What ties Robert, James, and Daniel together is a lesson every man over 60 needs to hear. A truth about medications, circulation, and how to protect both your heart and your vitality. The stories of Robert, James, and Daniel carry a truth that every man over 60 needs to hear. Sometimes it's not your age, your willpower, or even your health choices. It's the medication itself. Beta blockers, thiazide, diuretics, and statins are powerful tools that protect your heart and extend your life. But they can also have quiet, unintended effects on blood flow, energy, and vitality. The key lesson is this: you don't have to choose between survival and strength. You don't need to stop your medication to feel like yourself again. Instead, you need awareness, strategy, and small adjustments that protect both your heart and your manhood. For Robert, it was understanding why his mornings changed and finding ways to boost circulation naturally. For James, it was learning that a zinc-rich diet and better hydration could balance out the side effects of diuretics. For Daniel, it was realizing that monitoring his hormones and fine-tuning his lifestyle could help restore energy while staying safe on statins. These stories remind us that knowledge is power. Once you know the hidden impact of these medications, you can take steps to protect your circulation without ever risking your heart. And perhaps the most important takeaway, you are not broken, you are not alone, and you are not powerless. If this video spoke to you, take one small step today. Don't ignore the changes in your body, and don't suffer in silence. Talk openly with your doctor, ask the questions you have been afraid to ask, and start making small adjustments that support your circulation while keeping your heart safe. If you found this video helpful, please click like. It tells YouTube to share it with other men who may be struggling quietly just like you. And don't forget to subscribe for more doctor-backed guidance designed specifically for men over 60. In the comments, type the word SAFE if you'd like me to share a 7-day meal plan that works alongside heart medications to naturally support blood flow. I read every comment, and your feedback helps shape future videos. And in the next video, I'll reveal a simple nighttime routine that helps men over 60 wake up with stronger circulation in the morning. You won't want to miss it. Disclaimer: this video is for educational purposes only and is not medical advice. Never stop or change your medications without consulting your physician. If you are on beta blockers, diuretics, statins, or other heart medications, always discuss side effects and treatment options with your healthcare provider.